Your doctor told you to eat whole grains, watch your portion sizes, and take your medication. You followed those instructions, and yet every year your A1C creeps a little higher. Your doctor adjusts your dose. You leave the office with a new prescription, and deep down you wonder, if I'm doing everything right, why is my blood sugar still out of control? I'm going to answer that question today, and the answer is going to make you angry. I'm Dr. Michael Reed, internal medicine physician and metabolic health specialist. After 12 years watching type 2 diabetics follow every protocol their doctors prescribed and still get worse, I had to go deeper into the science. What I found is not a conspiracy theory. It is published, peer-reviewed research that has been sitting in academic journals for years. Research that fundamentally changes how we understand blood sugar in adults over 55. Research that the standard 10-minute diabetes appointment doesn't have time to explain to you. Here is the core truth. There is one category of carbohydrate that most type 2 diabetics eat every single day, sometimes at every single meal, that is actively sabotaging their blood sugar control in ways that their medication cannot fully compensate for. This carbohydrate is not candy. It is not cake. It is not the dessert you eat on your birthday. It is something you've been told is fine, something that appears on hospital meal trays, something that has been quietly damaging your glucose metabolism for years while you were following the rules. By the end of this video, you will know exactly what that carbohydrate is, why it is particularly destructive after the age of 55, what 5 biological mechanisms it triggers in your body that medication doesn't stop, and what you can do about it, starting today, without changing your medication. We'll go through the clinical research, the actual metabolic science, and a practical protocol based on evidence, not on the same recycled advice you've been hearing for 20 years. If this kind of information is what you've been looking for, real metabolic science, explained without jargon, without agenda, specifically for seniors with diabetes, please subscribe to this channel. It costs you nothing, but it means this video reaches more seniors who are sitting in the same frustration you were in before they found this channel. They won't hear this in a 10-minute appointment. They need to find it here. Before we go further, this video is for educational purposes only. Always consult your physician before changing your diet significantly, especially if you take metformin, insulin, or any sulfonylurea. The information here is designed to help you have a better, more informed conversation with your doctor, not to replace that conversation. Let's begin. Let me start with what the research actually says, because I want you to hear the data before we talk about the mechanism. In 2022, a landmark meta-analysis compiled data from 426 participants across multiple long-term studies, some following participants for up to 20 years. The central question was simple. Is there a specific type of carbohydrate that consistently predicts who develops type 2 diabetes and who makes it worse once they have it? The answer was stark. Refined carbohydrates, specifically white rice, white bread, processed breakfast cereals, and white flour products, were associated with an 11 to 16% increased risk of type 2 diabetes per additional daily serving. More critically, in participants who already had type 2 diabetes, the highest consumers of refined carbohydrates showed the worst glycemic control, independent of total caloric intake. Let that sink in. Not total carbohydrates, not fat, not protein. Refined carbohydrates, specifically, were the variable that predicted metabolic failure across more than 500,000 people. But here's what makes this specifically urgent for seniors in this audience. A separate research group, the Singapore Chinese Health Study, followed 45,111 participants aged 45 to 74 over an 11-year period, tracking their dietary patterns and monitoring for type 2 diabetes incidence. What they found is something every senior diabetic needs to hear. The participants in the highest consumption group for refined starch had the lowest intake of the micronutrients most critical for glucose regulation: magnesium, fiber, and chromium. This wasn't a coincidence. Refined carbohydrates don't just spike your blood sugar. They crowd out the very nutrients your body needs to process glucose properly. They are metabolically hostile in 2 directions simultaneously. The third study I want to highlight is from Diabetes Care, one of the most respected clinical journals in endocrinology. Researchers followed 298 adults with type 2 diabetes, mean age 61, over 24 months. They divided participants into 2 groups. one following standard dietary guidelines, which included moderate consumption of whole grains and refined grains, and one group that specifically eliminated high glycemic refined carbohydrates while replacing them with lower glycemic alternatives. The refined carbohydrate elimination group showed a 0.9-point reduction in HbA1c over the study period. The standard guideline group, 0.2 points. That's not a small difference. That is a clinically significant gap, achieved through dietary modification alone without altering medication. Now, I want you to hold those numbers in your mind, 0.9 versus 0.2, as I explain why the difference is so dramatic, because understanding the mechanism is what separates lasting change from temporary improvement. Before I go into the mechanism, let me mention something quickly. I've compiled the complete protocol, every step, every dose, every timing recommendation, into a free download called The 5 Steps to Control Your Insulin Without Pills. It's the exact framework I walk every new patient through on their first visit. The link is in the description below. Grab it. It's free. jamaicareed.card.co. Now, the mechanism. Your doctor has likely told you that type 2 diabetes is a problem of insulin resistance. That is true, but it is incomplete. Insulin resistance is the result of something. It is not the starting point. And that something, for most seniors eating a standard American diet, is the chronic, repeated assault of refined carbohydrates on a metabolic system that, after the age of 55, no longer has the same resilience it did at 35. There are 5 specific mechanisms through which refined carbohydrates damage your glucose control, and they work together. Understanding all 5 is what makes the protocol, the one I'll give you later in this video, actually make sense. When you eat white bread, white rice, or a bowl of processed breakfast cereal, your digestive enzymes break down the refined starch into glucose within 15 to 30 minutes. Compare that to 90 minutes or more for intact whole grains. The difference is not subtle. Refined carbohydrates are, functionally, a glucose delivery system designed for maximum speed. That flood of glucose forces your pancreas to secrete a large burst of insulin to bring blood sugar back down. In a healthy 30-year-old, this system works. The pancreas is fast, the cells respond, and blood sugar normalizes. But here's what changes after 55. Your pancreatic beta cells, the cells that produce insulin, have been secreting insulin in response to every meal for 55 years. They are slower, less responsive. A 2020 review in the journal Diabetes Research and Clinical Practice showed that beta cell secretory capacity declines by approximately 1.5% per year after the age of 50. That means at age 65, you may have 20 to 25% less insulin secreting capacity than you had at 50, not because your pancreas failed, because it is tired. Think of it this way, your pancreas is like a sprinkler system in an older house. When a small fire breaks out, a small glucose increase from a handful of almonds or a slice of sourdough, it responds fine. But when white bread sends a wall of glucose crashing through your bloodstream, that old sprinkler system can't keep up. The fire gets bigger before it gets put out. And every time that happens, the system sustains a little more damage. The result? Postprandial glucose spikes that stay elevated longer, damage more tissue, and require your medication to compensate for something that should never have happened in the first place. Here is something your doctor has probably never explained to you. Every morning before you eat a single bite, your blood sugar has already been rising for 2 to 3 hours, not because you ate something, because your liver has been producing glucose all night. This is called hepatic glucose production, or more specifically, the dawn phenomenon. Around 3 a.m., your body begins releasing cortisol and growth hormone to prepare you to wake up. These hormones signal the liver to start releasing glucose into the bloodstream. In a person without diabetes, a small release of insulin stops this process quickly. In type 2 diabetics over 60, 2 things make this dramatically worse. First, the liver has developed its own insulin resistance. It ignores the insulin signal telling it to stop producing glucose. Second, and this is the direct link to refined carbohydrates, every day that you eat a diet high in refined starch, you fill the liver's glycogen stores to maximum capacity and you increase the liver's content of a fat molecule called diacylglycerol. Diacylglycerol directly blocks insulin signaling in the liver cells. The more refined carbohydrates you eat today, the worse your fasting glucose will be tomorrow morning. The liver leak doesn't happen in isolation. You are refilling the fuel tank every day with the exact compounds that make the faucet impossible to turn off. This is why your fasting glucose is often your worst number of the day. Not because of anything that happened during the night, because of what you ate the day before. Metformin, to its credit, targets this specific mechanism. It inhibits hepatic glucose production. This is why metformin works best for fasting glucose. But here is the clinical truth. No dose of metformin fully compensates for a liver that is saturated in diacylglycerol from years of refined carbohydrate consumption. The medication is trying to do remediation work on a foundation that keeps getting rebuilt. If you are taking metformin and your morning glucose is still above 120, what I just described is likely a significant part of why. Your muscles are the largest glucose disposal organ in your body. When insulin tells your cells to take up glucose, skeletal muscle accounts for 75 to 80% of that uptake. More muscle means more places for glucose to go. Less muscle means glucose stays in your bloodstream longer. Here's the problem. After 50, you lose muscle at a rate of 1 to 2% per year. This is called sarcopenia, and it is not optional. It is the natural progression of aging. By age 65, many sedentary adults have lost 20 to 30% of the skeletal muscle they had at 40. That is not 20 to 30% less capacity to lift heavy objects. It is 20 to 30% fewer disposal sites for blood glucose after every meal. A 20-to-20 analysis published in PMC confirmed that muscle loss is not just a passive reduction in glucose capacity. Aging muscle also accumulates intramyocellular lipid, fat between the muscle fibers, which actively triggers inflammatory signals that block the GLUT4 transporters that are supposed to move glucose from the blood into the cell. GLUT4 transporters are your muscle cells' glucose doors. Fat infiltration locks those doors. Refined carbohydrates provide the raw material for that fat infiltration. It is a closed loop of metabolic damage. You eat the refined carbohydrate. The fat accumulates in the muscle. The glucose door gets locked. The blood sugar stays elevated. You need a higher insulin response next time. The beta cells work harder. And over years, that circle tightens. There is a way out. When you contract a muscle, the glucose door opens without needing a key. Walking after meals uses this exact mechanism. Every time refined carbohydrates spike your blood sugar, your cells generate a wave of reactive oxygen species, essentially metabolic exhaust, from converting that sudden flood of glucose into energy. These reactive molecules trigger the release of inflammatory cytokines, specifically interleukin-6 and tumor necrosis factor alpha. Here is why this matters for seniors specifically. These two inflammatory molecules directly damage the docking sites where insulin tries to connect to your cells. The connection gets weaker every time this happens. You become more insulin resistant not despite eating, but because of how you eat. A 2023 meta-analysis of randomized controlled trials found that reducing refined carbohydrate intake significantly reduced IL-6, standardized mean difference, minus 1.23, and TNF-alpha, SMD, minus 1.04. These are large effect sizes. They translate directly to improved insulin sensitivity, reduced HbA1c, and lower cardiovascular risk. The damage from each individual spike is small, but over decades of 3 meals a day with white bread, white rice, and processed cereal, the cumulative inflammatory burden is immense. This is what researchers call inflammaging, the low-grade chronic inflammation that accelerates with age and is amplified by every refined carbohydrate in every meal. You cannot outmedicate this process. You have to stop feeding the fire. This last mechanism describes damage that is already in progress. I'm not telling you this to frighten you. I'm telling you because it's why stopping the damage now matters more than it did 10 years ago. Your pancreatic beta cells have been responding to every carbohydrate you've ever eaten. Every glucose spike demands an insulin surge. Every insulin surge stresses the beta cells through oxidative damage. Under chronic oxidative stress, beta cells undergo programmed cell death. They do not regenerate easily. And in a diabetic pancreas, there is an additional process, islet amyloid polypeptide deposition, a sticky protein that accumulates progressively in the pancreatic islets and impairs their function. Studies of long-standing type 2 diabetes show that by the time of diagnosis, many patients have already lost 40 to 60% of their functional beta cell mass. Each refined carbohydrate spike you choose not to eliminate is continuing to deplete a reserve that cannot be replenished. This is not irreversible. The direct trial, published in The Lancet, 5-year follow-up data released in 2024, showed that in patients who achieved significant caloric restriction and weight loss, beta cell function partially recovered. The pancreas has a capacity for resilience, but it requires removing the chronic stressor. The chronic stressor is the refined carbohydrate. Enough background. Here is the protocol. No more theory. Just what works, why it works, and how to start doing it. Priority. 1. Eliminate the high glycemic refined carbohydrates. What to do? Remove white bread, white rice, standard processed breakfast cereals, and white flour products from your daily eating. Not reduce, remove. Why it works. Every mechanism I just described, the insulin flood, the liver leak, the muscle trap, the silent fire, the beta cell exhaustion, all 5 are directly triggered by the rapid glucose release from refined carbohydrates. You are not treating a symptom, you are removing the cause. How to implement. Replace white bread with sourdough, rye, or 100% whole grain bread that lists whole grain flour as the first ingredient and contains at least 5 grams of fiber per slice. If the first ingredient is enriched wheat flour, it is white bread with a marketing claim on the package. Replace white rice with brown rice. Glycemic index of 55 compared to white rice's 72. Or use cauliflower rice for a 90% reduction in glycemic load. Or use lentils as your starch base. One study in the European Journal of Clinical Nutrition found that replacing 50 grams of white rice with 50 grams of lentils reduced postprandial blood glucose by 35%. Replace processed breakfast cereals with steel-cut oats, not instant oats, steel-cut, which contain a specific soluble fiber called beta-glucan that forms a gel in your digestive tract and slows glucose absorption. Consistent across multiple RCTs. 0.42% reduction in HbA1c compared to control diets. Common mistake? Patients eliminate white bread and replace it with brown rice cakes or multigrain crackers, which have a glycemic index of 70 to 87, higher than white bread. You've changed the color, you haven't changed the impact. What to do? Change the order in which you eat the components of your meal. Always eat vegetables and protein first, carbohydrates last. Why it works? When you eat fiber and protein before starch, the fiber forms a physical barrier in your digestive tract that slows the enzymatic breakdown of starch into glucose. The protein stimulates early GLP-1 release, the same hormone that expensive medications like semaglutide are designed to mimic. You get the physiological effect at 0 cost and 0 side effects. A clinical study published in Diabetes Care, 16 type 2 diabetic patients, mean age 58, found that when vegetables and protein were eaten before carbohydrate, peak blood glucose was 37% lower, and the overall area under the glucose curve was 44% lower compared to carbohydrate first eating, 37%, from plate order alone. How to implement. At every meal, start with your salad, your cooked vegetables, or your protein source. Give yourself at least 5 minutes on those before moving to the starch. No special preparation, no prescription, just sequence. What to do? Walk for 10 to 15 minutes within 15 minutes of finishing each main meal. Why it works. When your muscles contract during walking, they activate GLUT4 transporters independently of insulin. The glucose door opens without needing a key. Your muscles begin absorbing the postprandial glucose surge from the meal you just ate, pulling it out of your bloodstream before it has a chance to accumulate. A randomized controlled trial in diabetes care, designed specifically for adults age 60 and older, compared 3 15-minute post-meal walks to a single 45-minute morning walk. The post-meal walks produced a significantly greater reduction in 24-hour blood glucose. Post-meal glucose peaks dropped by approximately 20 milligrams per deciliter. A 2016 study in Diabetologia followed 41 type 2 diabetic patients with a mean age of 60. Post-meal walking of 10 minutes reduced postprandial blood glucose by 12% more than a single 30-minute walk. You do not need to sweat. You do not need athletic shoes. A comfortable 10-minute walk around the block is enough to activate this mechanism. Start there. From a dietary standpoint, here are the foods the evidence supports most strongly. Foods that actively lower fasting glucose and improve insulin sensitivity. Legumes, lentils, black beans, chickpeas, 2 to 3 servings per week minimum. Glycemic index of 20 to 40. Rich in resistant starch that feeds gut bacteria producing short-chain fatty acids that improve insulin sensitivity. Use dried and cooked, not canned in sauce. Non-starchy vegetables, broccoli, spinach, cucumber, bell pepper, zucchini. Fill half your plate, glycemic index effectively 0. The fiber slows the glucose absorption of everything else you eat in the same meal. Walnuts and almonds, 30 grams before a carbohydrate-containing meal, reduces the glycemic response to what follows by 15 to 25%. Apple cider vinegar, 15 milliliters diluted in a large glass of water, 15 to 30 minutes before your largest carbohydrate meal. A 2004 study in diabetes care, 31% reduction in postprandial blood glucose in subjects with insulin resistance. The acetic acid inhibits the enzyme that breaks starch into glucose, slowing digestion. Fermented foods, Greek yogurt, kefir, sauerkraut, associated with improved HbA1c and fasting glucose in type 2 diabetic patients through gut microbiome modulation. Eggs, complete protein with zero glycemic impact, rich in choline, which supports liver fat metabolism. Foods that spike blood sugar despite appearing healthy. Commercial whole grain bread. If the first ingredient isn't explicitly whole grain flour, the glycemic index is functionally equivalent to white bread. The label is marketing. Instant oatmeal. Processing eliminates the structural integrity of the oat, making it digest as fast as refined grain. The packet labeled lower sugar may have fewer calories but an identical glycemic index. Rice cakes, glycemic index of 82, higher than white bread. Widely consumed as a diet food that actively worsens postprandial glucose in diabetics. Dried fruit, raisins, dates, apricots. Concentrated fructose with rapid glucose delivery. A small handful of raisins raises blood glucose more than a slice of whole grain bread. Orange juice, even 100% fresh squeezed. The fiber has been removed. You are drinking a glucose solution. Eat 2 oranges. Do not drink the juice. Sports drinks and flavored waters. 20 to 35 grams of sugar per bottle, absorbed in under 20 minutes. The supplement evidence. Berberine, 500 milligrams, 3 times daily, taken with meals. A meta-analysis of 37 randomized controlled trials, 3,048 type 2 diabetic patients, found that berberine reduced fasting plasma glucose by 0.82 millimoles per liter, HbA1c by 0.63%, and 2-hour postprandial glucose by 1.16 millimoles per liter. The mechanism: berberine activates AMPK, the same cellular enzyme that metformin activates. In head-to-head comparisons, berberine showed equivalent efficacy to metformin at standard doses. Critical safety note: if you are currently taking metformin, berberine can produce an additive blood sugar lowering effect. Discuss it with your physician before starting and monitor your glucose more frequently during the first 2 weeks. Magnesium glycinate, 250 to 300 milligrams at night. Between 13 and 47% of type 2 diabetics have documented magnesium deficiency. Magnesium is a cofactor in over 300 enzymatic reactions, including the molecular machinery that makes insulin work at the cellular level. A meta-analysis in the British Journal of Nutrition, 18 randomized controlled trials, 1,097 participants, found significant improvement in fasting blood glucose and HOMA-IR with magnesium supplementation lasting 4 months or longer. Glycinate form preferred for tolerability. After 25 years working with type 2 diabetics, here is what actually moves the needle. The breakfast mistake I see in 70% of my patients: eating refined carbohydrate first thing in the morning, toast, cereal, orange juice, on an already elevated fasting glucose from the liver leak. This is the worst metabolic moment of the day to consume refined starch. If you are going to have a carbohydrate at breakfast, eat the eggs first, every time. The supplement timing error that halves effectiveness: taking berberine on an empty stomach. It must be taken with food. It only works when there is starch present to slow. How to read a food label for insulin impact: ignore calories. Look for 2 numbers: grams of fiber per serving and grams of sugar per serving. The ratio of fiber to total carbohydrate tells you more about glycemic impact than any other single number on the label. The cortisol-glucose connection seniors are never told. Chronic poor sleep raises cortisol, which directly stimulates hepatic glucose production. A single night of fewer than 6 hours of sleep can raise fasting glucose by 15 to 30 milligrams per deciliter the next morning, independent of what you eat. If your fasting glucose isn't moving despite good dietary compliance, ask yourself how you've been sleeping. If you take metformin and you begin reducing refined carbohydrates significantly, your blood sugar will likely improve. That is a good outcome. But it means your dose of metformin may become more powerful relative to your new, lower glucose levels. Tell your doctor what you're doing. Ask them to help you monitor for the early signs of overmedication. If you are on insulin, any type of insulin, this protocol requires direct physician coordination before you begin. Reducing refined carbohydrates while on insulin without adjusting doses increases your risk of hypoglycemia. This is not a reason to avoid the dietary changes. It is a reason to make them with your doctor's knowledge and guidance. Sulfonylureas, glipizide, glympyride, glibenclamide continuously stimulate insulin secretion regardless of what you eat. If your blood sugar drops because of dietary change, the medication keeps pushing insulin. Know the signs of hypoglycemia: tremor, sweating, sudden intense hunger, confusion, dizziness. If you experience any of those, take 15 grams of fast-acting glucose, 4 glucose tablets, or 4 ounces of orange juice. Measure again in 15 minutes. If it doesn't recover, call for medical help. Based on the clinical evidence, here is what to expect. Week 1 to 2. You will likely see a reduction in postprandial glucose spikes, measurable on your glucometer 2 hours after meals. Don't expect your fasting glucose to move dramatically yet. The liver's glycogen stores take 2 to 3 weeks to start depleting. What you will notice is less energy crash after meals, and in many patients, a subtle but real reduction in hunger between meals. Month 1, most seniors report a 10 to 20 milligram per deciliter reduction in fasting morning glucose by the end of week 3 to 4. Your postprandial peaks should be consistently below 160 milligrams per deciliter if you are following the plate sequencing and post-meal walking. Months 2 to 3. This is when your HbA1c begins to reflect the change. Studies show average reductions of 0.5 to 1.0% in HbA1c over 12 weeks in type 2 diabetics who eliminate refined carbohydrates. The patients with the highest baseline HbA1c show the largest absolute reductions because they have the most room to improve. Month 6 and beyond. With full protocol adherence, the research supports HbA1c reductions of 0.5 to 2.0% over 6 months. Some patients, particularly those with relatively recent onset diabetes and meaningful weight loss, reach a point where medication reduction becomes a conversation they can have with their physician. Let's recap what we covered today. There is one category of carbohydrate, refined, processed, rapidly digested starch, that is particularly destructive for type 2 diabetics over 55. Not because of calories, not because of sugar grams, but because of 5 specific biological mechanisms it triggers. The insulin flood that overwhelms your aging beta cells, the liver leak that raises your fasting glucose every morning, the muscle trap that reduces your body's capacity to absorb glucose from your bloodstream, the silent fire of chronic inflammation that damages the docking sites for insulin, and the progressive exhaustion of the pancreatic cells that have been working harder every year. Your medication is not designed to fight all 5 simultaneously. It is designed to compensate for 1 or 2 of them while you continue eating the foods that drive all 5. The protocol is not complicated. Remove the refined carbohydrates. Sequence your plate. Walk for 10 minutes after each meal. Add the supplements with the most consistent clinical evidence. Give your body 2 to 3 months to respond to not being assaulted 3 times a day. Now, I want to close with something important. For 40 years, the medical establishment told type 2 diabetics that their condition was chronic and progressive. That management was the only goal, that they would need more medication over time, not less, that the trajectory was one direction. Then in 2018, a research team published the DIRECT trial in The Lancet. They enrolled 306 adults with type 2 diabetes, average age 53, in a structured dietary intervention. No surgery, no new medication, dietary change. At 1 year, 46% of the intervention group had achieved complete diabetes remission, blood sugar in the non-diabetic range, off all diabetes medication. At the 5-year follow-up published in 2024, 27% of those patients remained in full remission. Your doctor may not have told you the direct trial exists. The guidelines have not fully incorporated it. The standard 10-minute appointment rarely has room for it. Now you know. Your metabolism is not broken. It has been given the wrong instructions. Refined carbohydrates are the instruction set that has been driving your blood sugar higher every year. You have just received a different set. If this video reached you, share it, not for the view count. For every senior who walked out of their last doctor's appointment with a higher dose and no explanation. For every person who has been told there is nothing else to do. They deserve to hear what you just heard. Tell me in the comments, what is the one thing about your blood sugar that your doctor has never fully explained to you? I read every single comment. Next week I'm covering the dawn phenomenon in full. Why your fasting glucose is often your highest number of the day, and the specific morning protocol that addresses it directly. You will not want to miss that one. This is Dr. Michael Reed. Know your numbers. Own your health.